Think weight loss injections are only about appearances? Think again. Today we'll explain how the new generation of metabolic drugs GLP-1 South and Dual GLP-1 GIP agonists are already changing cardiology and sleep medicine. You'll learn what the big trials actually showed, who might benefit, what risks to watch for, what it means for doctors, students, and families. Stay with me, because this could change how we treat obesity, heart disease, and sleep apnea in the next decade. Asterisk first, a quick primer. GLP-1 stands for glucagon-like peptide 1, a gut hormone that tells your brain you're full and helps regulate blood sugar. Drugs like Semaglutide mimic that hormone, lowering appetite and body weight. Then there are dual agonists. Tirzepatide, for example, which activate both GLP-1 and GIP receptors and can produce even larger weight losses. Think of it as switching from single-channel to dual-channel appetite control. But the story doesn't stop with weight. Recent trials show these drugs can change outcomes for the heart and even for obstructive sleep apnea. We'll unpack the evidence next. Asterisk. Until recently, many doctors saw GLP-1 South primarily as diabetes or weight loss tools. But the Select Cardiovascular Outcomes trial changed that view. Select enrolled people with overweight or obesity who already had cardiovascular disease and compared semaglutide with placebo. The headline, Semaglutide reduced major adverse cardiovascular events by about 20%. That's fewer heart attacks, strokes, and cardiovascular deaths in the treated group. Asterisk why? Is that important? Because it shows that beyond shedding kilos, semaglutide impacts several risk pathways: blood pressure, lipids, inflammation, and metabolic stress. In Select, patients also had improvements in blood pressure, LDL, and inflammatory markers. 4. Cardiologists. This is a signal to consider metabolic therapy as part of secondary prevention for selected patients. But a caution. TRIALS enroll specific populations under close monitoring. Real-world benefits depend on patient selection, follow-up, and managing side effects. We'll discuss those practical steps later. Asterisk. Mechanistically, there are several plausible pathways. First, weight loss reduces cardiac workload and improves insulin resistance. Second, GLP-1 South lowers systolic blood pressure and improve lipid profiles. Third, there are potential direct myocardial and vascular effects. GLP-1 receptors are in the heart and blood vessels. And animal and human biomarker studies show reduced inflammation and improved endothelial function. It's cardio put together. These effects reduce the atherosclerotic risk and probably the tendency for vulnerable plaques to cause heart attacks. But the size of benefit depends on baseline risk. People with existing cardiovascular disease or multiple risk factors are the ones who saw the clearest gains in Select. Asterisk now. The million-dollar question. Who should receive GLP-1 therapy specifically for cardiovascular protection? Current evidence supports considering semaglutide for adults with overweight or obesity and established atherosclerotic cardiovascular disease, in other words. Secondary prevention where the trial showed benefit. Asterisk for primary prevention, that is, people without prior heart attacks or strokes. We don't yet have the same level of mortality data. Shared decision-making is essential. Discuss expected weight loss, its potential cardiovascular benefit, costs and side effects like nausea, GI upset, and rare but serious events such as pancreatitis or gallbladder disease. Asterisk, here's another rapid development. In December 2024, the FDA approved Zepbound, a brand of tirzepatide specifically for adults with obesity and moderate to severe obstructive sleep apnea, OSA. It be used alongside diet and exercise. This is the first FDA-approved pharmacologic therapy for OSA tied to weight reduction. Asterisk. Why would a weight loss drug treat OSA? Because much OSA in adults is driven by excess tissue around the neck and upper airway, lose significant weight, and airway collapsibility decreases. Clinical studies that led to this approval showed improvements in OSA severity that correlated with weight loss on tirzepatide. But note, the benefit is largely mediated by weight reduction rather than a direct airway effect. Asterisk. This is a potential game changer for patients who cannot tolerate CPAP or who need additional therapy, but it's not a universal solution. CPAP remains first line for many patients, and long-term durability and access will shape real-world impact. Asterisk. Both semaglutide and tirzepatide produce large weight losses. Tirzepatide tends to produce greater average weight loss in head-to-head studies, but the evidence for cardiovascular outcome superiority is currently more robust for semaglutide. Select. That said, new data on tirzepatide's cardiovascular effects are emerging rapidly. Asterisk. Clinicians should therefore individualize choices. Consider comorbidities, cost and formulation preferences, insurance coverage, and side effect profiles. Some patients prioritize maximal weight loss where tirzepatide may win. Others prioritize the trial-proven cardiovascular benefits shown with semaglutide. Asterisk. Before we finish, safety and monitoring are crucial. Common side effects: nausea, early, satiety, diarrhea, and occasional vomiting, usually transient. Important, rare, but serious risks to discuss: pancreatitis, gallstones, and possible increased heart rate. For anti-amyloid concerns or thyroid C-cell signals in animal studies, real-world human risk appears low, but monitoring is recommended. Always check contraindications. Pregnancy. Personal history of medullary thyroid, carcinoma, or MEN2. Escardio *** monitoring plan for clinicians. Baseline metabolic panel and HbA1c if diabetic. Baseline liver function and lipids. Review medications for interactions. Educate patients about expected side effects and when to seek care. For those with OSA on tirzepatide, continue sleep follow-up and evaluate CPAP tolerance. Rather than stopping CPAP unilaterally, add SC resources. AdvocateHealth.com Neurology Advisor. Command always pair medication with lifestyle support, dietary counseling, resistance training to preserve lean mass, sleep optimization, and mental health support. These drugs are powerful tools, not magic bullets. Asterisk. GLP-1 and dual incretin drugs are revolutionizing metabolic care. Semaglutide showed a 20% reduction in major cardiovascular events in SLAT, real milestone for obesity-related therapies. Tirzepatide's approval for obstructive sleep apnea opens a new therapeutic avenue for many patients with obesity. U.S. Food and Drug Administration Lilly Investor Relations for patients. If you're curious, speak with your clinician about risks, benefits, and cost. For clinicians, consider metabolic therapies as part of a broader cardiovascular and sleep strategy, especially in high-risk patients. For students and researchers, the next 5 years will be exceptionally exciting. Watch for longer-term outcome data and head-to-head cardiovascular trials. If you found this useful, like the video, subscribe for more deep but simple breakdowns of medical innovation, and ring the bell so you don't miss updates. Comment below. Do you want a full FAQ video on side effects and insurance navigation? Let me know.